The bone of the thigh, which happens to be the largest bone in the body, is known as the femur. Anatomically, the thigh is the femoral region. The thigh is not actually part of the leg. Remember, anatomically, the leg is between the knee and the ankle. The thigh is, however, part of the lower extremity. Now, if we look at the thigh, it has some similarities to the humerus, but it has other things that are not quite similar. It has a nice rounded head. This makes a good ball and socket joint for the hip joint. If I take the head of this femur and plug it into the acetabulum of the os coxa that we just learned, now we have the hip joint. Notice that a ball and socket joint gives an extreme range of movement, which of course is very important for our motility. Now compare this to the shoulder joint. This joint is designed to be very strong, very weight-bearing. Remember, our shoulder joint, we didn't have much of a ball and socket. We had the head of the humerus in the glenoid cavity of the scapula, but it didn't really fit in like a ball and socket. In that particular instance, we're relying on the muscles around the joint for the stability. Here we have good bony stability as well as muscle stability. Now if we look at this femur, the proximal end has the head, and where the head is attached to the rest of the femur, we have what is known as the anatomical neck. Then we have two very large protrusions. The large protrusion laterally is known as the greater trochanter. The smaller protrusion posteromedially is the lesser trochanter. So those are similar to the greater and lesser tubercle of the humerus. Only here we have the greater trochanter and the lesser trochanter. And on the femur, anteriorly, there is a raised line between the greater and lesser trochanters anteriorly, known as the intertrochanteric line. Posteriorly, there is actually a crest of bone between the greater and lesser trochanter, known as the intertrochanteric crest. So the intertrochanteric line on the anterior femur, intertrochanteric crest on the posterior femur. Anatomical neck connects the head to the rest of the femur. The surgical neck is right below the lesser trochanter. Surgical neck right below the lesser trochanter. Now the remainder of the shaft of the femur is not very exciting. Anteriorly it is fairly smooth, uneventful. Posteriorly there is a ridge that runs down the length of the shaft of the femur. This ridge is known as the linea aspera. The linea aspera. Now as we get down to the distal end of the femur, we have the portion of the femur that is going to be involved in the knee joint. We have the smooth articulating surfaces that are going to be involved in the knee joint, known as the medial condyle and the lateral condyle. And then the bone surrounding that area is known as the medial epicondyle and the lateral epicondyle. Also, if you follow along the medial shaft of the femur and we go out onto the medial epicondyle, just before it takes a sudden turn and drops off, there's a very small little lump there known as the adductor tubercle. Now the students in the A&P 1 class are not responsible for adductor tubercle. However, any of the Anatomy 3000 students, you may well be responsible for the adductor tubercle. So how do we tell whether this is a left or a right femur? First of all, I think it should be obvious to you. You need to know where it is. It's in the thigh. And you need to know that the head of the femur helps form the hip joint. So the head must point in toward the rest of your pelvis. It wouldn't make sense to have the head pointing away from the rest of the body. So the head must point in toward the rest of the pelvis, and there's a line down the posterior femur called the linea aspera. So point the head medially, have the linea aspera in the back, and that should tell you this is a left femur.